I would like to thank all our co-collaborators and sponsors who have been instrumental in putting this event together. Deborah Cameron from Carer Gateways, Wellways Australia, and Jane Elor from Community Junction. I will now pass over to Deborah to tell you more about Carer Gateway Wellways Australia. Over to you, Deborah, and thank you and enjoy the day.
Thanks so much for that, Heather. So good morning and thank you for all attending this special Rare Disease Day event. It's the first one I've attended. So my name's Debbie Cameron and I'm from Wellways Australia and I'm the coordinator for community engagement. For those of you with a family member living with a rare condition, I'm inviting you to consider getting free services available for all carers through the National Carer Gateway program. Wellways Australia is a leading not-for-profit organisation looking after carer reforms in southwest Sydney, Nepean and Blue Mountains and all of Queensland. This is a national program, so whenever you call 1800 422 737, it will take you to the organisation providing Carer Gateway services. We have two partners, Little Dreamers, who are a specialist organisation for young carers specifically, and Dementia Australia. They help us deliver services led by Wellways Australia. Now, the eligibility is quite broad, and more than one person can care for an individual care recipient at a time, and this includes refugees, and carers can be very young or well-aged. Carers must be at least caring for 6 months, and even if that time will be in the future, that's fine. This includes caring for anyone with a disability, a chronic health problem or condition, including a rare condition, dementia, mental health needs. These don't need to be diagnosed, or someone who is about to enter or who is already in palliative care. This can include a carer who has recently lost someone. The types of free services and supports include counselling, peer support, carer coaching, and emergency respite at any time where it's needed within about 72 hours. Over a 12-month period, carers can access centre-based services and get a flexible package. This may be as broad as short-term hire of equipment for the person you care for if they're not eligible for any subsidies through other programs, domestic services inside and outside, planned respite, transport, driving lessons for those young carers, retreats, school holiday programs, gym memberships to include your health and wellbeing, and anything else that's relevant to you as a carer. Carers may otherwise choose practical supports, such as school uniforms or equipment, IT equipment, an iRobot vacuum cleaner mop. So it again is quite broad and centred to the carer. These services and supports are there to help carers get a break, help them access better skills and knowledge, help them look after themselves, because I know that you forget that sometimes, and take some time out and ultimately sustain the carer in their caring role. The carer plan is actually delivered just in a 1-hour phone session or more for aged carers, together with our staff after a needs assessment during that call. The program is not means tested, but carers must be unpaid carers. The carers payment and carers allowance is not part of that criteria. If this sounds like you or someone else you know, please complete the consent form you'll receive in a survey afterwards, and we will contact you in about 5 to 7 days. Otherwise, please call 1800 422 737 nationwide. The number again is 1800 422 737. Please look after yourselves so that you can continue that caring role for others as well. This includes all members of your family, your close friends, and of course yourself. Thank you so much, and I really encourage you to join up with Carer Gateway and get some free help. Thank you.